So good afternoon, Happy New Year. Wonderful to be starting the new year with all of you in this way. My name is Nadia Islam, and I am one of the leaders for National CEDER, or the National Center for Engagement in Diabetes Research. And welcome to our first learning exchange of the new year. CEDER does host a learning exchange series across the year, really focused on supporting community engagement in diabetes-related research. And I will just say that all of you are in for a huge treat today with today's learning exchange, which will focus on developing participatory budgets with equity in mind. So this is our agenda. I'm going to start with just a very brief overview of CEDER. It's great to see many familiar faces, community partners, and researchers from across the country online, but we'll share a little bit of an overview of CEDER, our mission and goals. And then I will turn it over to our leaders for today's webinar, who I'll be introducing shortly, and then we'll wrap up with some closing and next steps. Next slide, please. So CEDER is a national center. As I mentioned, we are funded by the National Institute of Health and IDDK. And our goal is to provide resources and technical assistance really to promote engagement and partnership in diabetes-related research and programs. And we really intentionally want to support both researchers who are pursuing different questions related to type 2 diabetes, but we also want to support community members and community-based organizations who are often leading important evidence-based programs around diabetes, collecting primary or secondary data in their communities to fill our gaps in knowledge, and could also use the support of a center like CEDER to promote partnership with other academic investigators or other communities across the country. So our vision is to foster both community-led as well as community-informed diabetes research, really by integrating partnership with a variety of sectors across the research spectrum. We're really fortunate to benefit from an expansive partnership. Our co-lead institutions include NYU, where I'm based, but also Albert Einstein School of Medicine and UCLA School of Medicine. But even more importantly is our network of both academic as well as community partners across the country. So we work with 18 schools of medicine and schools of public health across the country, as well as 10 community-based organizations, both national and local community-based organizations who are integrated into our leadership and really help guide our efforts. Next slide. So the CEDER Learning Exchange series really aims to share examples and best practices of positive research and community partnerships that highlight community engagement in type 2 diabetes research and programs. So one of the things we heard from our partnership hub, as we launched CEDER about 3 years ago, is that there are so many great case studies and examples of how academic researchers and community partners have really partnered effectively to address diabetes disparities across communities and have had real impact. And something that we are really trying to do through CEDER is to highlight and promote those best practices that we've learned. We also have designed the series to increase the audience's understanding and expertise about policy, communications, grant writing, which is the focus of today's part of today's learning exchange, community-based participatory research, and other topics. And the participants and audience of these learning exchange are all of you, and that includes our partnership hub members. It includes clients who have reached out to CEDER, who we've provided consultations or studios to, as well as other individuals interested in type 2 diabetes research and community engagement. Next slide. So here we are at today's webinar. And as I mentioned, it's really such a pleasure to be able to introduce the team that is leading today's webinar. in part because they're dear friends and collaborators who I've had the honor of partnering with over many, many years, decades now, I feel like. And as you can see from the slide, it's a large team who will be involved in leading today's webinar. But I'm going to start by introducing um, my friends and colleagues and important members of our partnership hub for CEDER, Dr. Tabia Henry Akintobi and Mr. LaShawn Hoffman. So I sort of feel like they need no introduction. They're rock stars and famous in their own right. But I'll just briefly highlight some of their many accolades. Dr. Henry Akintobi is professor and chair of community health at Morehouse School of Medicine, and is really a globally sought after health equity champion and social behavioral scientist. She has really countless leadership roles, serving as principal investigator of the Morehouse School of Medicine Prevention Research Center, which is where we have had the opportunity to work closely together. She also leads the Georgia Community Engaged Alliance SEAL, funded by National Institute of Health, and is PI or senior advisor on a number of other statewide and national initiatives, including the Georgia Center for Diabetes Translational Research and the Georgia Clinical and Translational Science Alliance. She's numbered, she is an absolute expert in the area of community engagement and partnership, reflected in her publication record. And I think most recently, um, edited a book called Community Centered Public Health Strategies, Tools, and Applications for Advancing Health Equity. So, you will really enjoy hearing from Dr. Akintobi today, as well as from her close colleague and community partner, Mr. LaShawn Hoffman. I've also had the privilege and honor of working with LaShawn for many, many years now. He serves as chairperson of the Morehouse School of Medicine Prevention Research Center Community Coalition Board since 2010. And I think that's actually where our paths first crossed, LaShawn. And in that role, he's led diverse teams tackling health disparities through community-based research. He is truly a visionary leader in civic engagement, community development, and public health. He does lead a boutique consultancy specializing in smart community development, strategic planning, public health advocacy, really focused on the upstream factors, social determinants of health that we know are driving so many of the disparities in our communities. So, for example, Sean has led and managed a number of initiatives regarding affordable housing, community land trust models, and other really innovative strategies. So I will turn it over to Tabia and LaShawn to introduce the rest of their very esteemed team and get us started on this exciting webinar today.
Nadia,
Great.
thank you so much for that warm introduction. I'm really excited to be with you guys today. I'm just going to briefly introduce one more important colleague to the Partnership Hub that has been a part of the Center for Engagement in Diabetes Research, and that's Dr. Raquel Coral. She is a professor in the Department of Community Health and Preventive Medicine. She is an associate director at the Prevention Research Center. She's an accomplished researcher that really focuses her time and energy in chronic disease prevention and self-management. She leads our core research project at the Prevention Research Center, among many other things. And she is one of my partners in good that signs me up even when I don't know I'm being signed up for wonderful activities and adventures together. And so I'm really excited to be doing this work with her and our other colleagues in good that I'm going to toss it to Dr. Akintobi to be able to introduce.
Thank you so much, LaShawn, and Raquel and Nadia. This is an extension of many years of partnership, both with you and those that are collaborating with us today to talk about both the challenges and realities and wins related to equity in every dollar. So I'm also really excited to introduce Dr. Rhonda Holliday, who is a professor in the Department of Community Health and Preventive Medicine. She's a leader in CBPR, in translational research. She is among also our secret weapons because she is also the chair of our social behavioral IRB. So as we think about the innovations in advancing community engaged research, she really represents us nationally and globally. And um, Nisi Johnson, who is a dear community partner. And I think across all of us, we are partners in community engaged research, but we also are partners personally. And that's what makes this road sometimes challenging. It makes it sweeter. And we navigate those because we are collaborators across life and CBPR. Nisi is a nurse, she is a lawyer, and she is a leader of a community-based organization called Visions. And we've been honored in her patience with us as we have navigated her leadership, but also roles that she's evolved as a community PI in many NIH grants and others. So all of us will be telling a story, but we will also be hearing yours today. So we look forward to an engaging time today. Next slide, please. Can you all see the screen?
I do not. I think we
Courtney will be
lost the
taking
slides.
over. Sorry.
Here she is. Thank you so much. Got amazing team members on and off the screen. So you are here because we will be talking with, and hopefully you'll be sharing with us your experiences in what we hope to do through CEDER and all community engaged research, and that is to advance equity in every dollar. And we're going to unpack what that means to us, and hopefully you'll also share what it means to you. Next slide. You can go to the next slide, please. Yes, so the objectives for today, we want to discuss values, practices, and models for supporting equitable community engaged research. And certainly that includes diabetes translational research, which is the goal of CEDER. And then we also want to share an adaptable tool to support the navigation of transparency, negotiation, and then we'll talk about how we apply those. So we're going to be breaking into groups to talk a little bit about what we've learned, but also what you have learned and ways that we can share some of these values and practices. We talk about values, practices, and tools because the things that we do and the models that we choose to own or adapt should be based on those things that we value and how those values translate to practices. Next slide, please. And so we're going to start with our first poll to really help us to level set who is in the room. And so we're asking you to tell us what organizational role best describes or represents you today. So we'll give folks a minute to share who they are. Looks like the poll is moving along nicely. And it looks like we've just about landed, so thank you. And we can see here that we have a fair spread between community-based organizations and academics. And of course, we see those as among the primary audiences. But as you all think about where you sit, what your organization represents, when we soon break out into breakout rooms, those who identified as health systems, government, or other, hopefully you'll see where you might be leaning towards in your service to or representing a community-based organization or an academic or research institution. So we want to make sure that we're participatory and responsive. So while we knew we had an idea of the number of registrants, this helps us in real time to be able to make sure that our time together is meaningful and relevant to those who are actually in the room. So thank you for that. And hopefully you can see the results there. And we can close the poll. Thank you so much. Next slide, please. So just as a quick level set, we know that many of you, just based on some of the names that I see that are familiar, partners, collaborators, or folks that we've been fans of over time, we don't want to take for granted that it's always important that we think about our language and the distinction between community engagement and community engaged research. And certainly CEDER is focused on community engaged research, and that can include CBPR. And we want to be sure that we point you in the direction of thinking about the distinctions but synergies between community engagement and community engaged research. And as you think about your budgets and the equity and the partnerships behind them, that you make sure that you're thinking about not just the research, but the community engaged research that we believe is inextricably connected to community engaged research. So as you can see, the definitions of community engagement, it's a process of involving community members in activities and decision making. And some of those activities and decision making may be in those activities and decisions that they lead, and that we are coming alongside them to perhaps, as academics, bring the health or research perspective towards. So in community engagement, the focus may not necessarily be research. Really, it is about that relationship building. You see the purpose there, enhancing and maintaining trust. And what I say is the pursuit of trust, which is trustworthiness. Those are things that happen after 5 o'clock on the weekends. It is about the people behind the reason you want to partner for research. It's about that social exchange and relationship building, without which you will not be able to navigate the equity journey. We know it is not easy. We know that the academy has historically not done right by communities. And so, for all of those reasons, showing up, participating, engaging, and developing relationships is what community engagement is about. And it is not distinct, but it is, in our eyes, necessary, a precursor, something that comes before, that comes after. It's a throughput towards communities and partnerships for community engaged research. People need to know that you care about them, their organizations, their mission, their vision, not before, but even if there is no research that you are working with them on or that they may lead. So consider your language, because oftentimes we are challenged. There is a misperception that community engagement is not rigorous. It's just about bringing people together in a room. And we collectively know, and I invite those who don't to think about the fact that high touch community engagement, relationship building is a requirement for community engaged research to be effective, but also to be sustained, and to have its biggest impact. Next slide, please. So one does not happen without the other. And I would say community engagement is necessary before, during, after, and when there is no community engaged research. This just gives you a bit more information, and many of you know this already, but just to level set for all of it, all of us, community engaged research, it's a framework or approach. It may be used with both qualitative and quantitative methods. And when we have our next webinar in March, we'll unpack telling the story through evaluation in ways that many of you have thought of, and hopefully we'll share some innovations as well. It recognizes and builds on communities, institutions, and individual strengths. So it requires an investment of time. And it's characterized by principles that guide the research, whether it's CBPR or some other approach or framework. And at its root, ideally, it requires a commitment to local and national health issues, health priorities. And so this is the framing, hopefully, of our discussion on the partnerships, as well as making sure that budgets reflect those priorities. And you'll get these slides after today's talk. Next. Why do it? And so We believe, and hopefully collectively we believe, that community input and leadership in research improves the science. It increases the trust, and so improve is through that trust and trustworthiness in science. And we know in the past 3 to 5 years, in part due to the pandemic, the politics and policies related to public health, the ivory tower of the academy, that there is less trust in science than there was less trust in the academy. And so we need for community leaders to be guiding and leading community engaged research to flip that script and help us to get back to where we want to be. And that is where science plus community engagement improves health, especially by addressing health disparities. And hopefully, with community engaged research, we are moving forward more quickly the translation of research to discovery and translation or application through community leaders and organizations that can do it better than we can. On average, it takes 10 to 20 years, on average 17 years for research to come out of a book or out of a report to the communities where the impact is needed. So hopefully through our partnerships, we can do this more quickly and effectively. Next slide, please. There's a scientific basis for community engaged research, and you'll see this a bit more when you have the slides in front of you. But studies have shown, and this is just in another way for those of you who need citations as well. We need to empower and power community and patient leaders to be engaged as partners in research, and we're going to talk about partnerships shortly. Not, as we know, hopefully, just to help us to recruit, retain, look at materials, but to really be leads at the table equitably in the team science. So from the very beginning, from thinking about the research question or the health priority, that their community wisdom is guiding and leading us in the collective us on how to work better together. And so some of these advantages include increased trust, deepened understanding of the cultural perspectives, among many of the things that you see there. Hopefully, this is not an introduction to most of you, but I think it's always important to level set because it's a reminder to all of us as to why the partnerships and the money behind them really reflect equity. Next slide. And so some of you may have seen parts of this continuum of community engaged research. Most of us, in some way or another, if you are familiar with community engaged research, whether a community leader or an academic, you may have seen the two-sided arrow that's in the middle of this figure. And it talks about moving from no community involvement, all the way to community-driven, community-led research. And hopefully, a member of the team can please put the link in the chat again to this article, which is one of the resources that one of my mentees, but a global leader in community engaged research, Dr. Kent Keyes, among others, they expanded on this two-sided, two-arrowed continuum to say there's more behind just identifying where you are in terms of the community engaged research that you're doing. I'm doing community participation research or community initiated research. More important is what is under the hood, what is behind the veil, because that can help to determine the degree to which the community engaged research actually happens effectively. So we know there are equity indicators. Despite where we are, particularly since 2025, equity indicators continue to exist. And among them, Dr. Key and his team talk about power and control, decision making, influence, mutual benefit, ownership, responsibility, and resource sharing. These are the things that are important to the partnership and the ways in which we want equity to show up in the partnership and in the budgets. And then there are also contextual factors, the degree of history with the partners, trust, relationship building, respect, and transparency. So, what you saw in the chat was a link to the full text of that article. Please review it because you may choose to cite it as something that you've prioritized in your partnerships already, and they can help you to justify also some of the things that you may be prioritizing in your community engaged research. It's not just about the intervention, but it is about that partnership and the depth you can demonstrate by discussing how you have wrestled with and thought through these issues that can be the barriers or facilitators to the community engaged research that you and your partners implement. Next slide. So here comes poll two. Poll two is, which value do you believe is most often missing in community engaged research partnerships? And so I talked a little bit about some of those: equity, as well as contextual factors. And so think about this. Some of you may have may have been or are a part of partnerships that are newer or more mature. We all still wrestle with and acknowledge these factors. And hopefully, as you are responding to this poll, you're thinking about not just what you see over there, but what you might see in your own partnership. Ah, all right. I am going to end the poll as it slows down, and hopefully we'll be able to see the answer to the questions. It looks like equitable compensation and long-term commitment have gotten the most, the most frequently occurring responses. Let's see. Hopefully you all can see the results. Give me a holler if you can't. But equitable compensation and long-term commitment beyond the grant were the ones that you all cited most. So um, partners who are co-facilitating, let's make a note of those things. We see it as well, and it's something that we continue to work through. And it's the reason why we are having this meeting today. All right. Next slide. Thank you so much. All right. So another way to think about these are to also consider those barriers to community engaged partnerships. So we just talked about equitable compensation, as well as the issue of commitment beyond the grant, which I talked about earlier. So go to that QR code and Courtney, do let me know in the chat if folks indicate that they're having challenges. We'll try and also put you can either go to the QR code or go to menti.com, and you'll have a couple more questions as we lead into the meat of our discussion. All of these issues are important. So when we think about equitable budgeting, we cannot think about it without first reminding ourselves of the issues of the partnership. Um, and what we want to address, not just through the community engaged research, but the partners that are working together. So take a look at that mentee. And Courtney, I'm going to leave it to you to share the results of this as we pivot into our discussion of budgets. Someone said, can we pick all of them? Look, they all are issues. So thank you for that reality check. All of these are issues. I think our mentee allows you to rank them. But certainly all of them are issues. Depending on the partnership, we may have different numbers for each of these, but they all are issues. Thank you for that. Relationship building, yes. Trust, and certainly transparency so far have come out as those issues and contextual factors that you are thinking of in advancing your relationship for your community engaged research relationship. So yes, relationship building, and perhaps that's connected to this issue of how does this relationship last and supersede funding? And we know, and many of us this year more than ever before, that funding comes and goes. How do we ensure that that partnership is sustained amidst these changes? Great. All right, we can go to the next one, please. And again, all of this is designed to have us really take a look at the issues that are important to you, but also to make sure that as we have these discussions, that we're really thinking about those factors that also matter to the audience, to our community, our CEDER community. So this is a question on the equity factors that are priorities for you, mutual benefit. And we know that benefit can be fiscal and it can be non-fiscal. And so again, here is you all's nod to the how benefit shows up. And so we know the benefits cannot only be non-fiscal. So again, equity in budgeting. And then resource sharing. When we think about our budgets, of course, we need to be thinking about those resources beyond the things we know are frequently important, like training and capacity building. What are those resources that we intentionally talk about that are allowable in the grant that we build in that are important to all partners? We can go to the next slide. And I think I am turning it over to Dr. Quarles. Let me know. Just give me you can come off mute or let me know if this is mine as well.
You can take it or me.
I'll take it. I'll take it. I'll take it.
Okay.
I'll take it. And then I think I'll turn it over to you. See,
Okay.
we're having fun now. All right. So this is now more about you. So we're leaning in now. We were zooming out, now we're zooming in. At what point are partner roles and responsibilities typically discussed in your projects? So now we're getting into this notion of how partnership, yes, we are partners and that looks good on paper, and yes, we're friends in real time, but now we are talking about the community engaged research project, the roles and responsibilities. When do those discussions happen? They need to take place early, often, and I say it not because we ideally are doing it the way we should, but as we think about the rate limiting steps in compelling grants, but also sustained partnerships, these are some of the things that we need to be more thoughtful of. What point? Before the funding is pursued. 78 or the majority are saying that. And I appreciate those that have said yes. Sometimes it is after. Sometimes it is after. Not ideal, but when you have a partnership that has been developed with or without funding, um, it's easier after the funding to say, we want to make an adjustment because this partner who we may not have thought about before, or that time did not allow us to engage, is critical to the work. So thank you for that. And I'm going to share the results. Yes, these results are so important to share as we think about some of the issues we are considering. Next slide, please. All right, I think now I am turning it over to you, Dr. Quarles, Raquel.
Yes, you are. Thank you all for sharing and participating in those polls as well as the Menti. It gives us a sense of who's in the room, and also as we move into this discussion of our budgets, how things that we need to or should highlight. So one of the things that's important when we're thinking about equity-centered budgeting is making sure that you are clear on your partnership with whomever you're choosing to partner with. And one of the tools that we are planning to share with you is a memorandum of understanding for mutually beneficial research. And that really is the key, that it's mutually beneficial in terms of that partnership. And so when this tool, this template that we are sharing, that you will be able to find on the CEDER Resource Hub, you'll find the PDF there. But the importance of creating this MOU, or Memorandum of Understanding, is that when you sit down and decide to partner with someone, going through all of these different things that may come up or may be important in terms of the project that you are choosing to partner with, partner on. And so while no, the MOU is not a contract, it is not legally binding, but it is an opportunity for you and your community partner, or you and your academic partner, to set the ground rules for this partnership. And so our suggestion is that as you begin to form a partnership, perhaps specific to a research study, that you go through this process to make sure that everybody's on the same page. And so in setting the ground rules, how are decisions being made for this project? Who owns the data after the project? Are there certain aspects of the data that will be owned by both partners, and some aspects of the data are only owned by one partner? But getting all of that out in the open up front is important. The other piece, thinking through the cultural sensitivity. Is it appropriate for the communities that you are planning to operate within? And making sure that the voice of that community is acknowledged and responded to in terms of the work that you're doing together. And so as you are defining your partnership, you want to make sure, we've already shown that this mutual benefit, this benefit being mutual on both sides, you want to really go ahead and be able to spell out what is the benefit that not only am I, as the academic partner, getting out of this partnership, but being clear what is the benefit that my community partner is getting. But then also, what are the risks that may come with this partnership, that may come with the work that we're going to do together, and deciding on how you're going to address that. What are the timelines? How is the project being managed? You want to think through communication. How often are you meeting? Getting all of that out in the open, it just makes for an easier partnership once you are in the midst of the study, when other challenges may arise, if you can address some of these things early on. And so that's one of the reasons why we wanted to really share this template, where it allows you to go through these decisions together with your partner. And so our suggestion is that you sit down with the partner, not that one side completes it for both sides. If it's really a partnership, then you are working through it together, and you are making sure and acknowledging what are the skill sets that both are bringing to the table, as well as what happens after the project is done. So we saw that part of where did I see that? After the funding, I think in one of our polls, thinking through what happens after the project. Tabia talked about earlier that community engagement in research really is dependent on community engagement before, during, and after the funding. And so making sure you're clear on how does this partnership go beyond the funding? And I think I saw that long-term commitment was also one of the things that was rated high in the poll questions that we asked. And so you want to spell that out. So next slide, please. We have one more poll for you. We know we've been working you. So in this poll, we are asking you, what do you see as the biggest barrier to advancing equity-centered budgets based on your experience? I see them coming through. And what we also have experienced and the work that we've been doing, we have seen and heard from groups and in the networks that we've worked with all of these challenges. We've certainly had our share of institutional, our funder restrictions and challenges. We have seen in working within different networks the challenge of undervaluation of community expertise and the desire for more guidance and more tools to be available to help with the work that you're doing. And so I see that we've got a good number. We can go ahead and in the poll. It looks like most people are putting the institutional and or funder restrictions. And then next is the undervaluation of community expertise. Although we're seeing people choose all of them. There is a good bit of people that have chosen each one of these. So that's important to know. So what's going to happen now is that we are going to, if you can take the slides down, Courtney. So with us having 70 people on this call, we wanted to have a more intimate conversation to be able to actually have a conversation about budgeting and where and how and experience how budgeting happens, the challenges that you have experienced. What we know is that on this call, there is a wealth of knowledge and experience around community engagement research. And so we are going to have us go into breakout rooms because we think that it would be easier and better to have a more intimate conversation. So by breaking us into two different groups, we would like to have that discussion between over the next 45 minutes. So in hopes of having more engagement, more exchange in our discussion about budgets, we're going to have you choose to go to one of two breakout rooms. The breakout rooms are divided by community, government, and agency partners. And then the other breakout room is researchers or academic partners. Let me tell you that both groups will get the exact same slides. Both groups are also being led by an academic and a community partner. Part of our discussion in the investigator group, we talked about a number of challenges, and one of the common challenges that people acknowledged is the budgeting for language and translation, how is that to be handled? Making sure that your materials are translated in a way that is appropriate for the community that you are working in, and recognizing that all translations don't work for everybody. It's not a one size fit all. And so thinking through the budgeting for that, and remembering to put that in the budget.
One additional thing was community looking at the budget. And, I think sometimes we get pushback. Well, I can't show you the budget because, there's ways that you can show the budget in a manner that doesn't necessarily disclose the salaries of staff, but you can be translucent where you may not be able to be 100% transparent. And I tell people all the time, I'm translucent in some of my work where I can't be 100% transparent, but there are ways. There's ways that you can be able to do that to continue to build your trust. Rhonda and Nisi, what came up in your sessions?
We had some really good discussions and shared experiences whereby some of our trusted partners were transparent and some of the things that they had encountered towards budgeting. And also, I think we came back, and I think one of the most valuable inputs was that make certain that when you are looking at a project or a program or getting ready to develop a budget, to include your financial person, your CFO, or whoever that other person may be handling finances, because they can see the overall operational cost and not just a programmatic cost. So I think that was one of the key takeaways that we certainly have. And then saying no. Not, if the administrative load is greater than what is being offered for a program, then it's okay to turn things down.
Mm-hmm.
Anything you want to add to that?
Yeah, and also for the CBO to be familiar with the funding announcement that they're being included in, to know what that funding announcement is about, so that they can see what the requirements are, so that they won't be bamboozled and have any surprises. That helps with transparency and gives them knowledge about what the funding agency is asking, and what the requirements may be for community-based organizations from the funder.
Thank you so much. We're going to toss it back, but I do want to address one thing really quickly. Robin, we didn't have a tool, but we are going to provide some resources. And please note that we're available to have I'm available to have another conversation if you'd like to have one offline that helps you to better understand kind of some of this work. Raquel, you was going to say something really quick before we toss it over?
Yes, we do have a tool. It's the MOU template. That's what we were referring to as the tool. And so that it's a PDF. And so we'll have, that's going to be, it has been loaded to the CEDER resource page, and you can download it from there. Is that right, Emma?
Yes, thank you. Appreciate it.
Raquel, on one of the slides in the researcher breakout group, you shared a sort of a budget template. That I thought that was really helpful as well. And I guess it'll be shared in the slides as part of this.
Yes. Yep. And like LaShawn said, we are open to being contacted and having the discussion. Although I just realized that our email addresses aren't on the slides.
We'll put them in the chat.
Contact Emma.
Yeah.
Awesome. Well, with that, I just wanted to say thank you to everyone. Thank you to presenters. Thank you for the discussion and everyone who joined. This was just a fabulous webinar and discussion. I am very energized. I come from both the community and the research world, and just fabulous discussion with that. So again, more to come. And just in the last minute, I just want to share a couple of things. Sarah, if you can go to the next slide. Not sure if we can. Sarah, can you go to the next slide? Perfect. So number one, if everyone can take 1 minute and do a quick evaluation of today's event, we'd really appreciate it. So just use your phone for this QR code. The next slide. Here are some of the resources that were shared today. We will also share them via email, and they will also be on our resource hub, which is coming soon from CEDER. Next slide. And then last thing, save the date. This fabulous team is leading a second event in March, focusing on evaluation. There will be a registration coming soon. We will also explore possibly another opportunity to talk about the topic today, since there's so much interest. And then finally, very quickly, again, as Nadia mentioned at the beginning, CEDER provides free consultations in studios, which is really just providing support to you on your project and your research. Please reach out. We'd love to connect with you and support you and connect you to all of these wonderful experts from today. They are part of the Partnership Hub and are available to meet with you. And then finally, so sorry. Just a couple of things. One, you can find us on LinkedIn. If you are not already following us, please check us out there. We have lots of updates about events and resources and all of the wonderful members. We'll have other learning exchanges coming up throughout the year, and we also have a quarterly newsletter. So I think that is it, I hope. Awesome. So again, thank you to everyone. Have a wonderful rest of the day. And again, just fabulous, fabulous discussion, and look forward to working with all of you soon. Take care. Thank you.